Each year, hundreds of thousands of patients around the world are diagnosed as suffering from a reduced level of consciousness. Cases can vary from acute conditions in ICU patients to chronic conditions. Research has revealed that through repeated fMRI and EEG assessments, a significant number of these patients demonstrate increasingly robust cognitive responses to stimuli over time. Yet the majority lack the motor capabilities required for observable communication.
As a neuroanesthesiologist and researcher who works closely with unconscious patients and their families, I understand that the most crucial part of their rehabilitation is communication.
For patients like these who are unable to communicate, the terror of being ignored, trapped in silence, can be a descent into a nightmare of helplessness. What if there were a way to bridge this terrifying gap and promote actual communication with patients who suffer from reduced consciousness? Introducing Eyecon, a breakthrough system that promotes communication in patients who are diagnosed as suffering from reduced consciousness. By employing a simple, user-friendly EEG headset that tracks brainwave patterns and eye muscle contractions, even covert signs of reaction to stimuli are monitored. With persistent repetition and meticulous monitoring, effective stimuli are used, such as music, fostering increasingly reliable responses over time. This groundbreaking system allows us to promote and encourage communication with these patients and provides a critical pathway to understanding their needs, desires, and more. Developed by researchers from Rambam Healthcare Campus and Reuth Rehabilitation Hospital, the system can be used either in hospital or at home and is comprised of 4 key elements: a single-channel EMG and EEG channel positioned at the patient's forehead that captures brain waves and evaluates eye muscle contractions. Computer software, which processes EEG and EMG data, enabling real-time communication. An operator, who can be a family member or friend, who activates the software and aids in rehabilitation. Medical staff, comprised of dedicated team members who provide offline guidance to the family and oversee the rehabilitation process.
When the patient blinks, the music resumes. And actually what happens is that the actual blinking by the patient activates the music. So this is the first time a family can see that there is someone there lying in the bed. It's not a comatose patient anymore.
Eyecon is designed to be easily operated by the patient's family at the patient's bedside, both in the acute state in ICU and in the chronic state, enabling families to actively participate in their loved one's rehabilitation process, offering new hope to families and their loved ones. Eyecon, communication beyond boundaries.